When most of the people think about dangerous outbreak, they usually think about viruses, COVID-19, that type, or perhaps another global pandemic. But today, health experts in the US are worried about something very different. Not a virus, not a bacteria, a fungus. And unlike most infections, this one has earned a frightening reputation because it can survive for weeks on hospital services. And it can spread silently among patients in the hospitals who are already critically ill. Well, the name of this fungus is Candida auris, and according to the latest health report, cases have now been confirmed across 23 US states, with more than 3,000 clinical infections reported so far this year. Texas has reported the highest number of these cases, followed by Michigan and Illinois. Now, before you become alarmed, there is one important point that you should understand. This is not another COVID-like situation, not at all. Health experts say that this fungus is not spreading widely in schools, shopping malls, airports, or public places. Its biggest threat is inside hospitals, nursing homes, long-term care facilities. And that is because this virus mainly affects people whose immune system are already weak. Patients who are on ventilators, those recovering from major surgeries, people using catheters, feeding tubes, or other invasive medical devices are the individuals who are more vulnerable to the infection. And you know why are doctors concerned here? Because this virus is becoming increasingly difficult to treat. Many strains of this fungus have developed resistance to some of the most commonly used antifungal medicines in the world. In certain cases, doctors are left with very limited treatment options, making it harder to control serious infection. And yes, another reason this fungus worries the hospitals is its ability to survive. Unlike many other organisms that disappear after routine cleaning, this fungus, it can remain on the hospital equipment and surrounding surfaces for a longer period if strict infection control measures are not followed by. Now that increases the risk of transmission inside healthcare facility only. Now many viewers may be asking, should healthy people be worried? Well, according to the health experts, the answer is reassuring. For people who are generally healthy, the risk remains very low here. Most healthy people, they are unlikely to develop a serious infection from this Candida auris. The whole concern is mainly for patients who are already seriously ill and receiving treatment in hospitals or long-term care facility. But still, this breakthrough carries an important lesson. The medical world has spent years focusing on viruses and bacteria. Now doctors are also being reminded that drug-resistant fungal infections, it can become an equal serious challenge. As fungi becomes more resistant to available medicines, hospitals will need stronger infection control system, faster diagnosis and better surveillance to protect vulnerable patients. In the meantime, for Indians, Americans, whoever is living in America, certainly those who are elderly or who are already on a medical treatment, good hygiene, following hospital safety protocol and seeking timely medical attention if doctors suspect an infection can all mark a significant difference. Because sometimes the most dangerous health threat, they are not the ones making daily headlines. They are the ones spreading quietly behind the hospital doors. And yes, while American hospitals are dealing with an invisible health threat, Canada has introduced a new law aimed at protecting something very different. It's democracy. A brand new foreign influence registry has now come into force, and it could have important implications for organizations, lobby group and diaspora communities. And that's definitely our next story tonight.